Thank you very much, Steve. I realize it's late. I'll try to keep you awake with this talk. A couple of financial disclosures. I don't think this has anything to do with what I'm going to talk about. So this is pretty much what the hype was for notes in 2007. This is a slide that Paul Swain shared with me. And his thought was that notes and all its variations would be the next major evolution. And I want to emphasize, he said evolution, not revolution, in surgery, and that we would go through this transition, a very logical and rational transition from laparoscopic surgery to hybrid or laparoscopic assisted, and ultimately get to pure notes. Now, about the same time, in fact a little before that, after posters by Kalu and Reddy and Rao's clandestine video sort of circulated around the world, the leaders from SAGES and ASGE got together and sort of wrote the white paper on notes, and I think all of us in this picture have aged a little bit since then. But if you actually go back and read this paper, you'll find that most of what was said in it, I'd say about 85% was correct. And the point was that notes was to be introduced in a safe manner. We weren't going to try to repeat what happened with the introduction of laparoscopic cholecystectomy. And in 2005, this was very much on our minds. And we also were entering a different era in terms of oversight from regulatory bodies than what existed in 1989. And certainly in terms of the political climate, the culture of safety, and so forth. So I think that this statement was that the first human procedure should be IRB approved and recorded in a registry, and using the experience of lap chole, I think was very important, and I think it was the right thing to do. On the other hand, it had a lot of unintended consequences in terms of doing procedures that would not be approved for by insurance companies or oversight by agencies that regulate medical devices that would label these procedures as being extremely high risk and so forth. So this statement got taken a couple ways. It was intended to protect patients, and as I'm going to show you, I think it did. Of course, there were these sort of hysterical articles, and Rick Green's a good friend of mine, but I can't help but use his article that he wrote here on the road to transluminal misadventure. If you look at the number of people that were injured undergoing a transvaginal, transgastric cholecystectomy in this country, you'd have a hard time getting to 5 fingers. Not to mention all the successful poems in the rectal cases, and I'm going to show you. So there was this, point counterpoint going back and forth, and I think the protagonist felt that this was going to be the next laparoscopy, and we were going to do everything by notes, and then the con thought that we were going to end up slaughtering innocent patients, doing crazy stuff. And so, in point of fact, unbeknownst to many of us, Daniel Sinai in New York had actually done a transvaginal assisted cholecystectomy in 2003. It had never been reported, and it sort of flew under the radar screen and then was reported. And that really was the first. In 2007, the leading medical journal, the New York Times, reported Mark Bessler's transvaginal chole, and at the same time, procedures done in IRCAD and in Brazil. It's hard to know which really was first, but these were the pioneers. And then subsequently, others did this transgastrically, taking 3.5 hours to take out a gallbladder transgastrically, as a number of places in South America as well. As far as I know, the first pure notes without any sort of hybrid assistant cholecystectomy was done in Brazil by the Souza brothers. And then ultimately, the person who had the most experience and then led the reports to the German registry was Carsten Zornig. And there were these trials, and if you go back and look at this, it actually was remarkably safe. And this publication in 2011 of the German registry, which is the largest in the world, had a complication rate of 3.1%, which is quite good. And if you look at your own complication rate for lap chole, I suspect it is not that good. There was a case-matched analysis comparing lap chole to transvaginal chole, again authored by Zornig, which showed equivalence. There are other studies which are non-randomized, but did look at transvaginal chole. This one, the second one down here, 2012 from Solomon, is from Kurt Roberts' group at Yale, and they show that the transvaginal cholecystectomies had less pain and a faster recovery than either traditional or single port lap chole. Now, NOSCAR was able to raise funds and has completed a prospective randomized trial of laparoscopic versus transvaginal cholecystectomy. I don't think it's in the abstracts for this meeting, but it's going to be reported very soon, and then you will see how this goes. But the fact of the matter is that it has been done in an extremely safe manner. Complications that occurred were things like pharyngeal lacerations from trying to take out stones that were too large transorally, and I think the transgastric approach is pretty much dead. But transvaginal still remains a viable option, particularly in Europe. Culturally, not widely accepted in the US, but definitely feasible. But this is a true NOTES procedure. This is per oral endoscopic myotomy, or POEM, developed by Haro Inoue, who now, I just saw him in the hallway, is over 400 cases. This is a true NOTES procedure, and I think this is kind of where NOTES really ought to end up heading in terms of complex interventional endoscopy. There's actually surgery done with an endoscope. Unfortunately, achalasia is an uncommon disease, so it's not that widely applicable, but this is a beautiful example of where one of the sort of spin-offs of NOTES that people weren't thinking about immediately when they were talking about taking out gallbladders or appendices through the stomach, through the rectum, and so forth. Then, since this is a colorectal session, I really wanted to focus on the rectal use of NOTES. And this is the first human case of a NOTES rectal cancer resection using TEM and laparoscopic assistance done in Barcelona. Sylla, one of my partners, flew over and did this with Antonio Lacy's group. And actually, it was very successful. The patient did quite well, had a good oncologic resection, 23 negative lymph nodes. And while not pure NOTES, this clearly was a spin-off of the transcolonic attempts to take out a gallbladder that started in 2005. So if you look at this, you'll see that the human rectal NOTES cases are occurring more and more frequently, more and more reports from all over the world. Now, there are a variety of different variations on the theme, and I would even include Tata in that as a form, although we didn't call it that at the time, of the same sort of push to take out organs through natural orifices, to operate through natural orifices in an attempt to decrease pain. Now, here's a list of the transrectal NOTES publication to date. You can see that there are a fair number of cases. There are multiple different centers. A lot of similarities, some very subtle differences from one institution to the next. Antonio Lacy probably has the largest experience in what he is called MANOS, which is microlaparoscopy-assisted natural orifice surgery. And I think others have coined the term sort of down-to-up TME with a transanal advice. And his series is over 20 patients and is in press right now in surgical endoscopy. Now, the nice thing about this, and one of the things that we realized when we were working in cadavers, was the hardest part of the TME, if you're doing it laparoscopically, is the distal portion. If you do this in a transanal fashion, going through the sphincters to get into the holy plane caudally, it becomes the easiest part. So you almost never have any coning or violation of the mesorectal fascia when you're doing the so-called down-to-up or the NOTES approach. So the visualization is spectacularly good, and you're not struggling to get retraction, to get angulation and so forth when you're coming at things from the down-to-up. This is the Hospital Clinic Barcelona pathology of his 20 cases. You can see that the margins are great, lymph node retrieval is fine, and the mesorectal envelope is intact in all 20 of the cases. I think the big challenge in terms of notes, and certainly a question I asked, what happened to notes as Steve has challenged me here today? Well, I mean, it's actually been very successful in certain areas that we didn't anticipate initially. This is the Transvaginal TME is a great example. Is it going to have better outcomes? I think we won't know until we do more cases, and ultimately, I don't know whether we'll ever do a randomized control trial, but at least we get enough data to compare. As I said, the statement that we made in 2006 about doing this under IRB protocol has been a double-edged sword. It has definitely led to better patient safety. It's provided insurance companies an excuse to deny reimbursement. It's allowed the FDA to label certain instruments as potentially high-risk devices because the procedures were high risk, and I don't know whether Herb Lerner's in the room, but he's been very thoughtful and trying to have a meeting of the minds between device development and the regulatory agencies. Obviously, as we shift to population management, ACOs, and a different form of reimbursement in this country, cost issues are going to be very important. And as I said, the regulatory and the economic environment has inhibited some of the device development that could really move this along. So what happened to notes? You know, I can remember when I was a young SAGES member hearing Morris Franklin describing the first sort of laparoscopic colectomies in the early 90s. And a decade later, still only 4 to 5% of colectomies were performed laparoscopically. When we put the cost trial together, we were at the 4 to 5%. And when the cost trial was reported in 2006, I think, we went from 6% to 11%. And now we're up to about 30 to 40% of colectomies being done laparoscopically. It took 17 years to make that transition. So if you want to start the clock in 2006, you'd have to give us till 2024 to see a similar type of progression. So I think that when you look at it in that perspective, what's happened to notes, I'd say it's been incredibly successful. Thank you very much.